Hi, everyone. Welcome back to another Mission CISD House Calls. I'm Craig Verley, your host, and we are joined once again by our favorite Dr. Daryl Stinson from Primary Care and Wellness. And today's subject is hopefully going to be one that a lot of folks are going to find fairly helpful, because hopefully we're going to be helping everyone decide where they need to be going when they do need to go to see a doctor and need to make some of those decisions, because we have more choices now than we had, say, 3 or 4 years ago, where our options were somewhat limited when we had maybe some sort of need for something relatively urgent or a sudden illness or injury or whatever. Now we've got options of our regular physician, urgent care clinics, freestanding emergency room options. There are other clinical options as well. How do we go about trying to make the best decision on some of that? Because I know, it may be something we think, oh, we need to go to the emergency room for, and that's our best and only option, and that may not necessarily be the case.
Oh, it's rarely the case. I always tell my patients, if you think you're not going to live overnight, then go to the ER. Or if you're just actively bleeding, or if something's, you need to go get something set. So that's kind of the main thing. Do I need an emergency room? But when something's going on, we're not like, why am I in this pain? Why am I not? This doesn't feel right, and it's concerning. But is it life threatening? Are you not going to survive 24 hours unless somebody does something about it? So that's the first question you may want to ask, and a lot of times that'll help. Sometimes it doesn't help. I don't know. This pain.
Well, we all panic a little. Yeah.
So, but you always want to avoid. You want to avoid going to the hospital. You do. You really, if you can stop off somewhere, maybe you don't need to go. Let somebody else guide you to the hospital. Always the best thing. Go see a something just below the hospital. There's plenty of options. And you forgot to mention the newest one, the most probably the one of the future, which is virtual.
True,
you can. There's so much virtual clinics out there that and you can sign up. Most of them will take your insurance, or they'll take cash. Most doctors are doing virtual. I mean, with the pandemic, it really rocketed that. But at least now more doctors have it set up where they can actually do a virtual clinic. You don't want to, and you could just, and even after hours, they have these virtual clinics. So you could just really get online, do a consult, and they'll guide you. They'll tell you, hey, you need to go to the ER. So that's one step. A lot of people don't like that. I don't feel comfortable with that. Well, then you have, first, go to a clinic. Our clinic is designed for the school district.
Mm-hmm.
That's why we have our, we're 8 to 8. You just walk in. You don't need to even call. You just show up. We're going to see you, but we're a clinic specialized in that, in dealing with people who are working. We're very sensitive to people's time, and we're very sensitive to the sick call, though, like what's going on with me, as opposed to mainly dealing with chronic illness, which is a lot of clinics in the area right now are burdened with. A lot of my colleagues, they just are very overwhelmed because they take on a lot of wellness for older people and sick people, and when somebody gets sick, it's hard to shove them in there and squeeze them in, and you may be there for a couple hours, and so a lot of people have that negative experience. In a clinic like ours, you don't have that, but let's say that it's after hours, we're closed, or it's on the weekend. You have all these urgent care clinics, these night clinics, or those kind of things you can go to first. Because they're and the reason is you're going to see the same type of doctor usually that you would see in the hospital, or these freestanding ERs, which are basically the same thing. A lot of people are confused about that. The freestanding ERs are not urgent care. These are very expensive, overpriced, overcharging places that the hospitals put up there. You want to avoid those. If you're going to go to ER, just go to the ER. But look for these places that are called urgent cares or night clinics, and that you can go see somebody. Usually they're open on the weekends. Again, like my clinic, we're only open in the mornings on the weekends right now. But you'll get a good idea of what's going. And if it's really an emergency, that somebody will see you and they'll direct you. You know what? We need to get you to the hospital. Okay. But so I always say, like I reiterate, if you don't think you're going to survive the night, then okay, go to the ER. But if you think it's possible that you're going to survive, you won't be well, but you won't die, then avoid the ER. A lot of patients have a good doctor. They've been with their doctor for years. They really trust them, but that doctor is can't see you that day. It's okay to see somebody else. It's okay to like it. I prefer you to see our clinic if you work for the school district because of it's going to be less expensive for you initially. The copay is less, and again, we are geared to the school district employees and their families. So but if anything, if you're just not, it's not practical for you, you're on the other side of town, well, find yourself a clinic that just does walk-ins and that may get you in and out. There are some clinics going around. I think in the future we're going to be seeing our pharmacies are going to have their own clinics. These quick little things. You go in there, they'll have a nurse practitioner, a physician assistant. Very simple, quick little thing in and out. You're going to see the HEBs. I think we already have them.
And a few of them have started to open.
University of Texas Medical School, their residency program are putting those out there, and those are little places that they're just starting up, but I think they're going to grab to where those will be places that you can go to. But again, when it's not life threatening, avoid the emergency room, and just use those kind of facilities.
Now, if I've injured myself, whether it's a sprain or we think it might be something to break or those types of things, I know there's a lot of folks that are going to immediately think, oh, well, I do need to go to see an ER, whether it's a freestanding ER or the one at the hospital. Is that really our best option in those types of situations?
No, it's not the best. Still, the best option is urgent care. A lot of these urgent cares will have their X-rays there at the hours that they're open. So, and that's a phone call, or you can just call them up and say, look, can I go get an X-ray right now? And if they say no, we can't. Okay, well, fine. Then you need to go to the ER. Those are for after hours. A lot of clinics have the ability to do X-rays that are these type of urgent care clinics or night clinics. They understand that that's going to be a lot of need. There's going to be a lot of people that injure themselves, and they need to kind of get an X-ray on there. So that's why we have an X-ray at our place.
Yeah. And part of this discussion too is a matter of yes, we want to be making the best choice we can in terms of where we go, the type of clinic or medical attention that we're seeking. Yes, we're paying, not everybody has insurance, but those that do have health insurance, there may be those that say, well, I'm paying for insurance, I'm going to go to the ER no matter what. Yeah. But the reality is that's still going to cost them more money in the long run.
It does. It's part. I always say, yes, you may go to the ER. Oh, well, I only paid this much. My insurance is going to pay for it. No, you're paying for it because that money is part of your paycheck. The more money that gets spent by everybody, that big dollar amount, that does take into your paycheck. Pretty much average, 25% of people's pay goes towards health care.
Do you think sometimes we maybe wait too long before we go to a doctor? Whether it's a clinic like yours or an urgent care or whatever?
Hey, this is 1994. I'd say yes. No, I don't see that as too much of a problem. It's changed, so people are a lot better about that. I do see a few people that will wait too long. Yes, it's amazing. They'll wait too long on certain things, whether it be something that just happened or they have a chronic illness and they're on medications and they'll just go long periods of time just not have any medications. It still happens, but it has changed in 30 years. How people's attitudes about that, they're a lot better at it, and It may just be the valley thing, because that's my only experience. But that's what I've seen. I've definitely seen it's a lot better than what it used to be.
Very good. So with all the choices that we have now in terms of the more immediate care needs that tend to pop up, our best bet is to just kind of stop and think for a moment.
Yes, stop and think, and again, there's people. There's plenty of options, from virtual to your doctor, to urgent care clinic, night clinics, and always think of those first. That should be primary. Again, hospital. Either somebody may direct you there, or unless you think that you're not going to survive. If you're actively bleeding a lot, that's probably the ER is probably the best thing.
We're just kind of dealing with this at a very high level, because there's so many different things that can happen to a person that we'd never be able to address everything. Where do I go for this, or where should I go for that? This is just kind of more of a global type of thing. So please don't take this as, well, they said, type of situation. It's more of kind of just a general guide for our average, I guess, garden variety illnesses and injuries that we all face as adults or parents or kids. If we've got kids at home, where they've cut themselves or twisted an ankle or fallen and hit their head, those types of situations is kind of more the general things that I'm hoping we're kind of touching with on a lot of these.
And I really do. I think virtual is going to be helping a lot in that case. Again, where you can actually you can see a doctor, you can see his face, how's he reacting. And that's important.
Yeah.
When you're talking to the doctor, and how I react, it does help the patient understand how serious it is or how not serious it is. And then again, also the doctor have a visual of what's going on, even if it's through the camera, through their phone or through their computer, and they can take a look and they can assess it better. So I think that's going to be one of the main changes as we go on to the next decade. I think we're really that's going to change a lot. And this may be a mute conversation in 10 years. We're like, remember when we were talking about people abusing the ER? And I hope that we'll be beyond that in 10 years.
Or we'll be starting with virtual and then letting them tell us at that point, you need to go to.
Right, and that's the whole thing about the doctor will tell you, hey, no, you need to go to your ER.
Yeah,
and I think that's the best guidance.
Very good. Well, we hope this little conversation has been helpful to you in terms of your options when we're faced with trying to make a decision on where to go to address our illness or our injuries or whatever our medical need is at the given moment. And we'll see you next time with a different topic on our next House Calls. Thanks, Doc.
You're welcome.